My name is Kourtney Brooks, and this is my informative speech on the Ebola virus. Of all the many epidemics and diseases among us in society today, there is one in particular that has had America in a frenzy. This is known as the Ebola virus to everyone. Like most people, I had no idea of what the virus really entailed, but more so, made my own assumptions as to what it was and how serious the virus was. We've been so afraid of this disease that we don't even feel comfortable with other people coughing around us or sneezing around us, especially in enclosed areas. Today, you will learn that Ebola is a very deadly disease and where it originated from, what symptoms to look for, how it's contracted, different types, and preventative measures, which you will see on the handout. The Ebola virus originated in West Africa with one person being infected, supposedly by a bat. Research shows that it started with one traditional healer who attempted to treat patients in Africa, and unfortunately she became infected as well. Her patients came to her funeral and 14 of those died. Since then, over 3,000 people in America have been infected by this virus. Of those 3,000, 1,500 of those have died. According to physicians on medicine.net, Ebola virus is a deadly virus that causes high fever and massive internal bleeding. It kills as many as 90% of the people that it affects. This virus is transmitted by contact with blood forces or body fluids from an infected person or by direct contact with the virus, in which of course can happen in a laboratory. This is why so many researchers have been infected and killed by this virus as well. This is also why the virus is easily spread through family members and friends that are infected. Being in contact and contaminated with needles can also transfer the virus from the needles to you. Once you're exposed to this disease, the symptoms can appear in as quick as 2 days or take as long as 21 days. However, research shows that the average is anywhere from 8 to 10 days. Some of those symptoms are high fevers, headaches, muscle aches, stomach pain, diarrhea, vomiting, rashes, and bleeding problems. And several of those bleeding problems are blood in the lungs, stomach, and also in the eyes. There's a protein on the surface of the virus that scientists have found, and this has been discovered to be responsible for the severe internal bleeding. The protein attacks and destroys the cells lining blood vessels, causing them to break and bleed. Although there is no specific treatment for this disease, there are several cases in which people that were affected were able to survive also. Just to name a few, according to NBC, nurse Nirma Pham of Texas Health Presbyterian Hospital was infected by treating patient Thomas Duncan. She was then treated in Maryland and declared free of the disease on October 24th of 2014. Just to name another incident, NBC cameraman Ashoko Mokpo contracted the disease in Liberia, and he was also flown to Nebraska Medical Center for treatment. He was free of the disease on October 21st of 2014. The best way to prevent becoming infected with Ebola is to avoid areas that have been affected. In addition to that, patients receive supportive therapy, which includes a balanced diet, fluids, maintaining oxygen levels and blood pressure, and being treated for any other infections. There are also barrier techniques used, and the wearing of protective clothing can help. Now that you've received the information presented on the Ebola virus, you should now have a better understanding of how to protect yourself from this. Unfortunately, dying is the inevitable, but if we can prevent certain things and protect ourselves at all costs, why not do so? Recognize the symptoms and act accordingly.